Tuesday, the 6th of January 2026, we are here with our lovely patient, and the plan is to do some facial rejuvenation surgery this morning. How are you feeling, Nikki?
Excited, very excited.
Good. I have been looking forward to operating on Nikki. We met a couple of times, we had really good consultations. We discussed her surgery in depth in terms of what she wants to achieve and what are the things that are bothering her. And it's quite common for patients to come back after the first consult and sort of go over things again and just discuss in detail exactly what we want to achieve with the surgery. It helps clarify the plan for me in terms of what I'm offering, and also it helps the patient understand what's the number one thing that bothers you.
My turkey neck, I hate it. I've always had it, but I've lost quite a lot of weight this year. It's just become really wrinkly and more pronounced. Yeah, absolutely hate it.
Okay. When patients say turkey neck, it's really important to examine what exactly they mean. And historically, patients with this issue would undergo liposuction under the skin. Now, that's not really an effective way to treat the bulk under the neck. In order to achieve a nice angle between the chin and the neck, we're going to have to do some deep neck work. There's a bone there called the hyoid. That bone, if it's quite forward, it can make the angle blunt between the neck and the chin. So what part of the surgery that we do is we make space for the hyoid to go. So we actually, through a small incision under the chin, we go under the muscle. We then take some of the fat that's under the muscle, which the liposuction can't get to because it reduces the bulk under the muscle. We also trim the glands. That's really important because that bone, the hyoid, which is sat here, for it to move backwards, it needs space, and the glands are blocking that space. When we lift naturally, it can nicely come up and it creates a beautiful chin-neck angle. It's what we call a cervical-mental angle. Number two, what else bothers you?
Baggy eyes, I've got quite a few fat patches under the eyes.
A very common thing that patients come and see me about. This, as part of facial rejuvenation, we would reposition the fat. So I like to use the fat to create volume where there's deficiency. Tear trough, you've got areas where there's hollows, so that fat is transported into the hollows and it creates a nice smooth lid-cheek junction, and that's a really aesthetic thing. We lift the smiles, the deeper tissues of the face. That creates a really nice, smooth, youthful contour. Okay. At the same time, we're doing the upper lid. The plan for today is upper blepharoplasty, lower blepharoplasty, deep plane facelift, deep plane neck lift, deep neck contouring. It's going to be a great outcome. I'm really looking forward to it. You're going to look like a younger version of yourself.
Excellent.
Okay.
Yeah, exciting.
Thank you.